Orient trials, what they call. The Orient 9 was on this thing, familial hyperlipidemia, was studied in US, Canada, Europe, and South Africa. It was given the same dose of 284 milligram versus matched with placebo, treatment period for 18 months, and the study has been completed. Orient 10 was on ACVD for 1500 odd patients were taken from United States, and 18-month study was done. And Orient 11 was ACVD or ACVD risk equivalent, which is done in Europe and South Africa. In fact, the same dose and followed, and all the three trials, Orient 9, 10, and 11, were based on 18 months study treatment. If you see the Orient pool analysis, you will see that most interestingly, this inclisiran demonstrates an effective and sustained LDL reduction. Please mark the words effective and sustained with lower inter-individual variability. What we mean that we can get down the LDL as early as say 3 months or 90 days, but we have to sustain it. There's no point in just again leaving the patient so that the LDL starts slowly creeping up and the patient starts having events. It has been seen that 50.5% sustained LDL reduction has been seen in these patients when you do a pooled analysis of 9, 10, and 11 Orient. And also 50.7% effective reduction LDL has also been seen, with inclisiran as a strong component given with maximally tolerated statin. Sometimes when these patients do not tolerate statins more than 20, 40, or 80 milligram, it is fair enough that you should keep a low dose of statin and then start with inclisiran to achieve the targeted levels of less than 50. And it was seen that 68% of patients achieved the LDL levels of less than 70 and 52% achieved the LDL levels less than 50. So these three trials pulled together shows that this is a very effective molecule, not only in bringing down the LDL levels, but also having an effective and sustained LDL reduction. Now, if you come to the Asian population, which was studied in the Orient 18, it was seen the geometric mean of lipoprotein A ratio to base from day 60 to 360 was significantly reduced with your inclisiran. Now, if you do the lipid levels, it is my suggestion that because we hardly have any drug to decrease the LPA levels. So decrease the LPA levels, where we Asian population have high LPA levels, low HDL levels, and high LDL levels. So here possibly is a drug where you can bring the LPA levels to the lowest possible by giving them as per the dose recommended. Now, the ratio of the LPA levels to baseline levels was approximately 41% lower compared to the placebo at day 330. Now, the Orient 10, it showed that inclisiran reduced levels of other atherogenic lipids and increased the HDL. Very interestingly, it is then we observed we have hardly any drugs which can increase HDL. And this has been shown that inclisiran can decrease total cholesterol by 33%, ApoB by 44, non-HDL cholesterol 47, triglyceride almost a very minimal decrease of 14.9. LPA decreases by minus 21% and HDL is raised by almost plus 7.5%. Among these, total cholesterol OP non-HDL reduction had a significant p-value reduction. So it is very important that this drug does not only decrease the cholesterol or the LDL, but also decreases the LPA, the ApoB, and has a modest or a mild rise in HDL-C. And that is what you will observe when your patients are kept on this inclisiran molecule for almost years to continue. Now, inclisiran was basically well tolerated, the safety profile similar to placebo, apart from the injection site reactions. These injection site reactions are very minimal, and patients are very comfortable and confident, except of course you ask me about the price, or else it is really true that the patients, they come with lipid profile reports which are possibly unimaginable. For example, if I tell you that one of my patients underwent after 2 doses of this thing that is inclisiran, I get a call from the biochemist that possibly the sample is wrong, because they are not able to detect LDL in the blood sample. So don't be surprised if you see that these patients have LDL even going below 0. There are some labs which do good reports, but we have seen that LDL levels are not detected when these patients are given Inclisiran. That means we have achieved the target of less than zero in these patients.